Good morning to the community of East Chicago and its residents. My name is Dwayne Mitchell, and I'm the Chief Operating Officer for East Chicago Community Health Center, located at 1313 West Chicago Avenue. And East Chicago Community Health Center is a federally funded community health center that strives to provide services for the underserved. Regardless of your ability or inability to pay, our service providers are available for you based on your health outcomes. The service process of East Chicago in terms of our providers, led by Dr. Jerry Browning, provides services for our adult population, pediatric services, well child services, OB/GYN services. We have extensive family medicine physicians who are board certified, trained in the best school systems, rotated through the residency programs throughout the country that have been onboarded at East Chicago Community Health Center for the last 4 months. One of the myths that the East Chicago Community Health Center has is that it is a free clinic, and that is not true. Our services are provided under a sliding scale program that is supported by a 330 funded grant through the Department of Health and Human Services and the Bureau of Primary Health Care. Through that sliding scale process, our patients are offered, based on 100% below the federal poverty level, a payment of $20. And that $20 provides you with an extensive medical evaluation with our providers. It also gives you an opportunity to link towards counseling activities through our enabling services. And those enabling services consist of case management, our behavior staff that provides you with linkages into medication programs. And you'll get an opportunity to hear a little bit more about that through the conversation with Dr. Jerry Browning. Our goal in terms of strategic direction is to expand the awareness of East Chicago Community Health Centers to the community at large. Our goal is to link services into the enabling school systems to ensure that access to all is really the priority that we in turn see. We're partnering with our faith-based community. We're also partnering with our community-based organizations. Our next step in the process in terms of our expansion is to work with Regional Mental Health Center as a part of a new access point coming within the next 3 to 4 months. That gives us an opportunity to provide primary care services to the most vulnerable population, those that may have a behavior disorder. And we believe here at East Chicago that health care is a constitutional right. The myth on the table also reflects that individuals who may be undocumented may not be allowed to be seen. And that is false. Through our process as a community health center, we cannot turn individuals away. Therefore, we do link those individuals into our sliding scale program. Through that process, as we begin to expand the opportunities of new grant initiatives through the state and local government, as well as through foundations, we see in the future that we have the ability to really connect with other types of disparities that impact our community. The prevalence of asthma, diabetes, hypertension, cardiovascular disease, ophthalmology services. These are critical needs within this particular community. And we feel very fortunate to be a part of the leadership process to bring those services to East Chicago Community Health Center.
So, you can see we just recently introduced our new televised health education system for our patients while they're waiting for us. So we have different health topics that are airing in a looped fashion throughout the day. So we removed our regular TV programming, and now we're offering health education for our patients. So as you can see, this is our registration area. And so when people come in, they can check in with our registration personnel, and they'll, get some demographic information and make sure that, we have everything that we need to keep them properly processed and handled throughout their service here. And then when the medical assistant is ready to bring them in and prepare them for their provider visit, they'll be called from this door and they'll enter into the clinical area from here. And then we can go and show you the clinical area. So sometimes when people come in, they're brought to this room, which is one of our triage areas. This is just an area where we can set people aside and find out why they're here for their visit today, whether it's a follow-up or whether they have a new complaint, whatever the case is. And then they are weighed and we get their vital signs, and then we take them around. The medical assistant will take them around into the full clinical area and be placed in an exam room where they'll wait for the provider who's scheduled to see them. Okay, now we'll show you some of the clinical areas. As you can see, we've got multiple exam rooms down numerous corridors here. We've got well over 20 exam rooms available for all the providers to see patients throughout the day. And this is another one of our busiest corridors, more exam rooms, but it leads to the central checkout area. After patients are seen in these areas, there's another corridor down that way as well with just additional exam rooms. Smile. As you can see here, this is our basic checkout area that I talked about earlier, where patients can schedule follow-up appointments. Sometimes they need return to work, return to school notes. Sometimes there's additional things that they may need. Sometimes they're waiting to go for lab services, so they'll receive a demographic lab slip from the personnel here at the desk, and then they can go here into our lab and have blood drawn or other specimens handled. As well, patients that need referrals to see specialists or to have tests done, those things can be scheduled here, and then they'll get their information appointments, and when they leave out these doors, they're ready to go.
Talk about the electronic health record.
One of the other things that East Chicago Community Health Center has been on the forefront is using the electronic medical record. Each provider has a small notebook, which is basically like a laptop, and we no longer use paper charts. We record everything into the notebook, so it's all computerized records, and that makes it easy when we need to print, let's say, a copy of your visit for today, or if you need an exam for your job or for school, we can print those things out. We can also print records, immunization records and things like that, making it much easier to handle patient records than in the past. So, and immediately behind you, this is our lab. And these are our lab technician, Tammy, and she's basically one of two who handle drawing all of our blood samples and handling other testing that we do here in our facility. And as you can see, some of our medical assistants are working doing some testing. We have a lot of in-house tests that we do. In particular, I think the ladies are working on hemoglobin A1C, which is an in-house test that we provide for diabetic patients, and it helps us to know how well controlled their diabetes can be. And it's a test that is considered the standard of care, and you should have on-site access to doing the hemoglobin A1C test. But it gives us an average look at the previous 2 to 3 months prior to you getting the test, and gives us a real good feel for whether or not your diabetes is controlled. So it keeps all of our patients honest. We always know if they've been cheating on their diets or not, and if our medications are working, and all of our other support services are doing the job to keep our diabetics controlled. So you can see it's quite busy around here, and this is a light day for us. Lots of people buzzing around all the time. These are two of our providers, Dr. Kirby and Dr. Richardson.
Hello.
So, and that's Esmeralda, my personal medical assistant. So, and on this wing of the building, we've basically got doctor and provider offices, and our medical assistants have an office suite over here, and we have storage. But we also are affiliated with the Indiana Breast and Cervical Cancer Program, which is a screening and diagnostic program to provide pap smears and mammograms for patients who are unable to obtain those services through, whether they're insured or not. And it's a very good program that allows women to access the proper screening that they need to maintain health, and if they are diagnosed with a problem, the program will see them through early, diagnostic testing and treatment. So it's a great program to have, and we have been in the past one of the largest providers in Northwest Indiana for that program. And so we had a break in that service, and we have it reinstituted, and we're happy to have that. Again, I'd like to thank you for taking the time to come and tour our facility and hear what we have to say about the East Chicago Community Health Center. Again, our hours are basically 8 to 8 Monday through Thursday, and 8 to 5 Friday and Saturday. We've got full medical health services as well as dental services. We have free pregnancy testing and prenatal care. That's the basic of what we have to offer. Our phone number is 219-397-1196. And remember our address, 1313 West Chicago Avenue. We look forward to seeing you here.
Our image to the community at large. This is a community health center, and we do not slight that. This center is for the community residents of East Chicago.